There may be a link between chemicals used in a variety of household items and heart disease deaths. They are known as phthalates, or everywhere chemicals, and they're used in cosmetics and shampoo bottles, detergents, food storage containers to make them more flexible. The Centers for Disease Control and Prevention says humans are exposed to these by eating foods containing them or breathing them in. And a new study from researchers at New York University and published in the journal eBiomedicine looked at the impact of these chemicals on men and women ages 55 to 64 in more than 200 countries and territories. They found they may have led to nearly 350,000 global heart disease deaths in 2018. That's more than 10%. For more, let's bring in Dr. Leonardo Trasande. He is the director at the NYU Langone Center for the Investigation of Environmental Hazards and senior author of the study. Doctor, thank you so much for being here.
My pleasure.
How were you and your colleagues able to find this link?
So first of all, plastics contribute to heart disease through multiple mechanisms. Chemicals used in plastic hack our hormones, affecting our metabolism, contributing to obesity and diabetes. They also contribute to inflammation. That is not good for our coronary arteries. And in addition, we know that phthalates coexist with micro and nanoplastics that have gotten a lot of attention lately. And those might be wrecking balls in our tissue, contributing to heart attacks and stroke. So we took global data on phthalate exposures, looked at data as well, linking phthalate exposures from our previous study, documenting relative risks in relationship to exposure, and then put those data together with global burden of disease measures to add up all the disease, the heart attacks and stroke and cardiovascular mortality events due to phthalates and ultimately plastic.
So for someone who's listening, they maybe want to go through their home and find out. How do you know what has phthalates and what doesn't?
So phthalates are usually represented in polyvinyl chloride plastic. They're added to soften that plastic material in particular. That's why that clingy wrap in food packaging is so flexible. There's a recycling number 3 that represents PVC or polyvinyl chloride. The other 2 numbers to avoid are 6 and 7. But fundamentally, if the big takeaway from this study is that we need to renegotiate our relationship with plastic. It's not just phthalates that are concerns. There are bisphenols, nonstick chemicals, the forever chemicals called PFAS that have gotten so much attention as well. And we need to particularly avoid microwaving and machine dishwashing plastic. That's a great invitation for chemicals used in plastic and micro and nanoplastics to get into our food and into our bodies.
So this is on a personal level, but what can be done on a macro level or a government level?
So we've seen some early signs from Secretary Kennedy that actually there's a willingness to address chemicals used in food packaging through the Food and Drug Administration in a way that hasn't been done before for 60 years. These have been assumed as generally recognized as safe. With a pen, the chemical industry can just wave their hands and no problem whatsoever. But there's also a global initiative, and that's particularly important because we see the highest impacts in Asia and the Middle East in particular. There's a UN negotiation going on for a global plastics treaty, a legally binding instrument that would address chemicals of concern in plastic and hopefully phase them out.
When you say phase them out, what would be your ideal year in the U.S. for a phase out?
2025 would be ideal.
Okay, immediate.
Because we have enough evidence to act now. The good news is you don't need a PhD in chemistry, and these steps don't have to break the bank. And the power of the consumer here is really profound. We've seen this with BPA-free labels on baby bottles. The FDA banned it back in 2008. So there are steps that we can take that drive ultimately manufacturer change.
Dr. Trasande, thank you so much for sharing your research with us.
Delight to be here. Thank you.